IMA seeks feedback on the use of Bayesian methods in clinical development. The European Medicine Agency has begun a consultation into the use of Bayesian method in the analysis of clinical trial data. Bayesian methods are one of the main approaches to statistical inferences. The methods incorporate prior information into the analysis and can calculate the probability that a hypothesis is a true. Frequent methods, another main approach to statistical inference, have traditionally been a standard technique for analyzing the clinical data. The methods are driven slowly by the data and give a p-value that shows the probability of observing results at least as extreme as analyzed dataset. EMA has published a draft concept paper on Bayesian methods. In document, EMA sets out the problems with the current guidance and outlines the plan to write a reflection paper about when to use Bayesian methods. The information and justification needs to support the choice and the importance of censors engaging early with regulators when considering using the approach. The International Council for Harmonization's guideline on statistical principles for clinical trials supports the use of Bayesian methods when the reasons for doing so are clear and the resulting conclusions are sufficiently robust. Other ICH and EMA guidelines also reference Bayesian methods, yet EMA has identified lack of clarity on when Bayesian methods can be accepted in the confirmatory setting and the methodological requirement needed to address potential regulatory concerns. Specific areas of certainty uncertainty include when companies must justify their use of Bayesian methods and how to handle the increased methodological complexities of the approaches, particularly when using external data. EMA's assessment of the uncertainties reflects an increase in the number of proposals it has received about enriching clinical trial data. Applicants have proposed using Bayesian methods to borrow historical or external data to draw a conclusion in the same or related population or to draw a conclusion in a populations where adequately powered trials are not possible, EMA said. The agency also noted the use of Bayesian methods to generate supportive evidence rather than confirmatory evidence used to seek approval and to inform informal decisions during early phases trials. Even if analyses are only used internally, Bayesian methods are part of scientific advice submissions and may be included in assessments of marketing authorization applications. EMA named using Bayesian methods to fit pharmacometrics models and in early phase dose finding as examples of supportive work. EMA is accepting feedback on draft until 30 April. The agency aims to release a draft reflection paper for consultation next year and finalize the document in 2028. So let's go to the reflection paper. Here you can see the concept paper for the development of reflection paper, which is started on November 2025, and the consultations will be starting from 30th January and it will be open till 30th April 2026. And they have introduced whatever the problems are there, and that's all. That's all today from my